How does a Medicare Advantage clinic operate? What happens at each step of the process? If you don't know how it works, watch this video until the end. You will learn about key clinical roles, the typical Medicare Advantage workflow, the critical difference between coding and chart prepping in a medical clinic, and how technology transforms this space. By the end, you'll have a clearer picture of how each role contributes to delivering high-quality patient care while ensuring compliance and efficiency. Let's dive in. First, let's start by understanding the key clinical roles in a healthcare clinic. While non-clinical staff, such as front desk personnel and administrators, play crucial roles, we'll focus on 5 primary clinical roles. 1. The medical assistant is usually the person who will bring the patient back into the room, take their vital signs, weight, blood pressure, and pulse, and ask the patient questions about the reason for their visit. 2. A registered nurse may see a patient for more complex screenings. They will also educate the patient about conditions and treatment, such as wound care, or may even be involved in some chronic disease monitoring programs. 3. The clinician will see the patient, examine them, make diagnoses, and order tests or medications. 4. The scribe will follow the clinician and write down what the patient and clinician said into the note. 5. A coder translates medical diagnoses into the correct billing codes. But oftentimes, the doctor or scribe picks the diagnosis code on the EMR, and the coder is utilized more in an internal audit validation capacity. Each of these roles contributes uniquely to patient care and clinic efficiency. However, coding and chart prepping require special attention due to their complexity and impact on financial and compliance outcomes. With those roles in mind, let's move on to how they fit into a clinic's daily workflow. Every Medicare Advantage clinic follows a process to ensure smooth operations before, during, and after a patient visit. Here's how it all comes together. Chart prep begins before the patient is even seen. Depending on the organization, clinical staff such as medical assistants or care coordinators may review patient histories and flag important health concerns. During the visit, clinicians focus on care while scribes capture the details in real time. Afterward, it's about writing the note, ensuring it's complete and compliant. Finally, coders step in, ensuring every diagnosis is accurately translated into a code that supports billing and risk adjustment. Most work in a Medicare Advantage clinic happens outside the exam room. Before the visit, it's about preparation, reviewing prior data, and setting up the clinician for success. Afterward, coders and billers ensure all information is accurately recorded and submitted. Now, let's clear up the difference between chart prepping and coding. Chart prepping happens before the visit. A team member, often an MA, scribe, or chart prepper, reviews the patient's history, lab results, and previous diagnoses. They look for potential diagnoses and identify these for clinician evaluation. Medical coding happens after the visit. The coder takes what was documented and correctly translates it into ICD-10 codes. These codes determine billing and reimbursement from Medicare Advantage programs. For example, let's say a clinician diagnoses a patient with heart failure. That sounds straightforward, right? Not exactly. There are dozens of codes for different types of heart failure, and these are then divided into 5 HCCs for heart failure, each affecting reimbursement differently. Also, a diagnosis and a code may not always be the same. Another example could be when a patient is being prepped for dialysis. They may need a fistula placed. This would be described as an acquired AV fistula. Typing this into an EMR or ICD-10 search tool will probably return I-77.0, AV fistula acquired, but this is not the correct code. I-77.0 specifically excludes being documented to refer to an AV fistula that was placed for dialysis, and instead directs the documenter to use Z99.2, presence of AV shunt fistula for dialysis, which can further confuse whoever is documenting, because the main diagnosis description for Z99.2 is dependence on renal dialysis. So they may be hesitant to report this in the case of someone who has an AV shunt but has not started dialysis yet. However, Z99.2 would be the correct code to document the presence of an acquired AV shunt placed for dialysis. This is why it's so important to code accurately. Choosing the wrong code can impact billing and even lead to audits. As patient volumes and documentation demands grow, technology lightens the load. Automation reduces errors, And DoctusTech's tools are transforming how clinics handle documentation and coding, making workflows more efficient and reducing administrative burdens. Here's how DoctusTech's HCC Patient Diagnosis Assist platform PDAP streamlines workflows, boosts accuracy, and ensures compliance. PDAP automates chart prep, reviewing patient histories and identifying missing diagnoses before the visit, saving clinicians time. It assists in real-time coding, ensuring compliance and proper reimbursement, and reducing the risk of errors. It enables clinics to scale faster by reducing manual workload and freeing up staff to focus more on patient care rather than paperwork. Alongside PDAP, our mobile learning app ensures every team member excels in their role, whether training clinicians on compliant documentation or equipping non-clinical staff with essential knowledge. Ultimately, technology like PDAP and our HCC coding learning app allows clinics to shift their focus from administrative burdens to delivering quality care. And that's how healthcare clinics ensure every patient gets the best care while managing complex medical coding. From understanding clinic roles to optimizing workflows and leveraging technology, every step plays a role in delivering top-quality care. Ready to see how DoctusTech solutions can transform your clinic? Let's get started. Get a demo today.